Hello, this is Neil Baum from New Orleans, and the theme for the next few videos that I'm going to create is called Getting Home for Dinner. And the way to get home for dinner is to enhance the efficiency and productivity of our practices. One of the ways that that can be done in this era of increase in paperwork is to get a handle on prior authorization. The current problems that we're experiencing today are decreasing reimbursement, rising overhead costs, and you don't have to be an MBA to compute that that leads to a potential loss of income. The solution is to improve the efficiency and productivity of our practice and to decrease overhead costs. So here is the concept of prior authorization and how to get a better handle and manage the prior authorization process. Prior authorization requires a tremendous amount of energy on the part of our staff to verify coverage. Payers will approve according to guidelines and algorithms. They will make a determination of the approval of medications that you prescribe. They want to make sure is cost effective, and they also want to be sure that alternatives have been tried first. So why is prior authorization important? Because delays in getting authorization for medication and various studies can lead to disease progression. It is very time consuming. It is not unusual to have a staff member spend a half hour, 45 minutes talking to an insurance company in order to obtain a prior authorization. Also, the prior authorization process results in the doctor having loss of autonomy because they question our decisions regarding procedures, tests, surgery, and medications. A survey demonstrated that how prior authorizations have changed in the last 5 years. And in terms of prescribing medication, there's been an 88% increase significantly or increase somewhat in the requirement for prior authorization. The same applies to medical services, imaging studies, and laboratory tests. There can be shown to have 87% increase in requirement for prior authorization for medical services. A prior authorization specialist, that is someone in your practice who is knowledgeable about the entire prior authorization process, can be a huge improvement in efficiency in your practice. These people are knowledgeable about ICD-10 and CPT codes. They understand step therapy. For example, a patient with overactive bladder, they usually require documentation that they've undergone a trial of behavior management, a generic drug is prescribed, and then finally they will allow a third-tier drug. As a result of using a prior authorization specialist, it produces less stress on the staff and it decreases denials. Denials are something that results in wrong paperwork being submitted, and it's sometimes a error as something as simple as a not providing the exact date of birth of the patient, not having an accurate CPT code, or the insurance ID is off by one number or one letter. That results in a denial, And that means a delay in getting paid for the services that you have performed. Prior authorization specialists understand red flag features. For example, a medication is prescribed to use 3 times a day. The doctor writes for 90 pills. However, the insurance company allows only 45 pills. That means that every 15 days, someone in your office has to contact the insurance company to get prior authorization for 45 more pills. This is a huge inconvenience and results in delays for patients. Another example, a 70-year-old lady with overactive bladder was prescribed a beta-3 adrenergic agonist. The insurance company only approves oxybutynin. Oxybutynin is contraindicated in older patients because it can lead to cognitive impairment. However, the prior authorization specialist understands this situation and can submit an article from a credible journal that demonstrates that oxybutynin is not to be used in older patients. The article is submitted and the area is underlined that you would like to call to the attention of the insurance company. And you can be sure when this situation occurs that nobody in the insurance company is going to demand when you have given evidence that it is contraindicated and then will allow you to use the third tier drug. So what's the bottom line on prior authorization? A specialist in your office can improve the efficiency. It improves the morale of the staff. You end up with happier patients, and you really conduct better patient care when patients don't have to wait to get medications, approval for imaging studies, or approval for surgery. Bottom line, it increases productivity. The take-home message on a prior authorization specialist is that it increases speed and access to medications, to lab tests, imaging studies, and to surgery. The take-home message in summary is that technology is available and improves the efficiency and productivity of our practices, and the urologist is home for dinner. Thank you.